Good afternoon, Ryan Hilton. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, welcome. Please come in and take a seat. My name is Ryan Hilton. I'm the community nurse here. I can see you look a bit worried. How can I help you today?
Thank you. Yes, I am a bit concerned. It's about my dad, Calvin. He's 75 and he's living on his own. Lately, I've noticed he's become, well, increasingly forgetful. He'll tell me the same story 3 times in one visit, and last week he completely forgot a doctor's appointment. It's starting to worry me, and I'm not sure what to do about it.
Thank you for sharing that. It's completely understandable to be worried when you notice changes in a loved one. Before we proceed, may I know your name, please?
My name is Mihiraa.
Mihiraa, my role here is to listen, to offer some information and support, and to help guide you on the next steps. Let's talk this through properly, starting with understanding what might be behind these changes. First, it can be helpful to know that memory changes in someone your dad's age can have a wide range of possible causes. Some are a normal part of aging, where things like recall might slow down a bit. But it's also important to consider other factors. For instance, sometimes deficiencies in vitamins like B12 can affect memory. Other times, a simple infection, like a urinary tract infection, can cause sudden confusion in older adults. We also can't overlook emotional well-being. Stress, anxiety, or depression can very much present as forgetfulness. With your dad living alone, have you noticed any signs of low mood, or has there been any significant stress or loss in his life recently that might be weighing on him?
He did have a bad chest infection about 2 months ago, but he seemed to recover. As for his mood, he's always been quite cheerful, but now he does seem a bit more withdrawn. He's not as interested in his weekly card game with friends. And his wife, my mom, passed away 3 years ago. I think he's been lonelier since, but he's always said he was coping.
That's very insightful. Thank you, Mihiraa. Grief and loneliness can have a profound effect, and that physical illness could have been a trigger. To get a clearer picture of what might be happening, it would help me to explore a few more details about the changes you've seen. To start, can you tell me a bit more about the forgetfulness itself? For example, when did you first start noticing it, and how often does it happen now?
I think I started noticing little things about 6 or 8 months ago, but it's definitely become more frequent in the last 2 or 3 months. Now, it seems like almost every time I speak to him, he repeats a question or forgets something we just discussed. Just yesterday, he asked me what time I was coming over, and I told him only an hour before.
I see. And besides the memory lapses, have you noticed any other changes? Perhaps in his personality, his ability to manage his daily routines, or even concerns about his safety at home.
Now that you mention it, he's always been very meticulous, but his house isn't as tidy as it used to be. I found some expired food in his fridge last week. He still cooks simple meals, but I worry he might leave the stove on. And he does seem more easily frustrated sometimes, which isn't like him. He got quite flustered when he couldn't find his bank book.
Thank you for that, Mihiraa. Those are important observations about his daily tasks and mood. Given what you've shared, the next crucial step is for your dad to have a proper medical assessment. This is important because while some causes might be simpler to address, like a vitamin deficiency or an infection, we need a doctor to make a formal diagnosis. A doctor would typically do a few things. They would conduct a cognitive screening, which is a set of questions and tasks to assess memory and thinking skills. They would also do blood tests to check for those reversible causes we talked about, like vitamin levels or signs of infection. Sometimes they might recommend a brain scan to get a clearer picture. The goal is to rule out treatable issues and understand exactly what we're dealing with. How do you feel about that suggestion? Do you have any questions or concerns?
I do think he needs to see someone, yes. My biggest concern is actually getting him to go. He's quite stubborn and very proud. If I suggest it's because of his memory, he'll likely get defensive and refuse. I don't know how to bring it up without upsetting him.
That's a very common and valid worry. Mihiraa, it's often the biggest hurdle. We can think about some strategies to encourage him. One approach is to frame the visit not as a memory check, but as a routine checkup for his overall health, especially after that chest infection. You could suggest you go with him for company and support. Emphasizing the benefit of early intervention can also help. You could say something like, let's just make sure everything's ticking over as it should so you can stay independent at home, which focuses on a positive goal. How does that sound? Would you be willing to try an approach like that?
Yes, that sounds much better. I think if I present it as a general health check and offered to go with him, he might agree. The idea of staying independent would really appeal to him.
That's great to hear. To help move this forward, with your permission, I can help by booking a consultation for him here at the center with our visiting doctor. That way, it's in a familiar, less clinical setting. Would you be comfortable with me doing that? I need your consent to go ahead.
Yes, please. That would be a huge help. Thank you. You have my consent to book the appointment.
I'm glad we could work through this together, Mihiraa. Let me just summarize what we've discussed so we're both clear. You're concerned about your father Calvin's increasing forgetfulness and repetition, which you've noticed more over the last few months. We talked about how this could be linked to several factors, including his past infection, possible grief, or other medical conditions. You've also noted some changes in his daily tasks and occasional frustration. We agree the vital next step is a formal medical assessment to get a proper diagnosis, which will involve specific tests. You're going to encourage him to attend by framing it as a routine checkup for his overall well-being and independence, and you'll accompany him. And finally, you've given me consent to book that initial consultation for him here. Does that sound like a good plan to you?
Yes, that sums it up perfectly. Thank you so much, Ryan. I feel much more informed and a bit less anxious. I'll speak to Dad tonight.
You're very welcome. You're doing a great job looking out for him. I'll get that appointment booked and give you a call with the details. In the meantime, please don't hesitate to reach out if you have any more questions.